president and founder of Healing Our Village, and executive director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. Do you think you have diabetes? Normal blood sugar is 60 to 100 milligrams per deciliter. You have prediabetes if you're between 101 and 126. And we diagnose you with type 2 diabetes if your blood sugar is 126 milligrams per deciliter or greater. The symptoms of diabetes can be different for every person. Are you always thirsty and hungry? Do you urinate many times during the day, especially at night? Have you been experiencing blurred vision or not seeing things as clearly as normal? Have you been experiencing tingling or numbness in your hands and feet? Have you noticed sores in your legs and your feet that don't seem to want to heal? Are you getting vaginal or urinary tract infections more frequently? Do you have to see your dentist more often because you have more cavities? All of these may be the signs of diabetes. If you're experiencing any of these symptoms, make an appointment to see your doctor right away. Did you know that more than 86 million people in the United States have prediabetes? Prediabetes is a condition where your blood sugar level is higher than normal, but not high enough to be diagnosed with type 2 diabetes. If your blood sugar is between 101 and 126 when you wake up in the morning, you may have prediabetes. What can you do if you have prediabetes? Well, start by changing your diet and exercising 5 days per week for at least 30 minutes. There are now CDC-approved diabetes prevention programs that focus on prediabetes. Healing Our Village is one of those programs. If you live in the Los Angeles, Atlanta, or Washington, D.C. area, call 800-788-0941 and sign up for classes today. Remember, the data shows that a third of the people with prediabetes can reverse their condition. Let's talk about diabetes and high blood pressure. It's estimated that nearly 75 million Americans aged 20 and older have high blood pressure. 1 in 3 U.S. adults have high blood pressure, and of those people, we know that 77% don't even know that they have it. African Americans in the United States have the highest rate of hypertension in the world. 30% of all deaths in African American men and 20% of all deaths in African American women are due to high blood pressure. African Americans are 4 times more likely to have high blood pressure than Caucasians. In most cases, we don't know what causes high blood pressure, but the good news is it can be treated, and there are things that you can do to reduce your chances of getting high blood pressure. We know that when you have high blood pressure, it causes the blood vessels to get stiff and narrow. This makes the heart have to work harder to get the blood through your vessels. High blood pressure can also weaken the lining of the arteries and veins so that it is more susceptible to cholesterol deposits. This narrowing of the blood vessels throughout the body can lead to problems with the heart, the kidneys, the brain, and the eyes. Everyone with high blood pressure should own a blood pressure cuff. It's important that you measure your blood pressure on a regular basis to make your medications work. The goal blood pressure for patients with high blood pressure and other conditions is 130/80. However, if a patient has diabetes or kidney disease, the blood pressure goal should be less than 130/80. People with diabetes especially have to keep their blood pressure low in order to achieve protection from heart attacks and, more importantly, damage to the kidney. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. if I get this contract for this clinical trial, we'll be doing a bunch of events. And so there's money in there for me to be able to get you back up to your higher salary. But I can't do that till I get, if this contract comes through. So the salary for Heroes remain the same, but there'll be additional funding for these concerts. We have a budget for that. As part of that budget, I have a whole an IT budget. So anyway, I'm pretty excited about that. I'm real excited about that. Anyway, so that's what's going on. I should know something soon. I think I'll know something in the next 2 weeks. I should know what I'm doing by the end of March. So it's pretty exciting. And I'm going to need a full-time video editor. That's what I'm saying. I don't want to get at odds with him because of the future. It's pretty bright. The Lord is opening up a lot of doors for me. I mean, amazing, amazing things. So, anyway, that's what's going on with my life. Oh my goodness, but I cannot let the devil succeed here. So I gotta keep it moving, All right. I gotta keep it moving. Okay. All right, life is good. Life is good. Gotta get myself together here. Keep it on. Get it together and keep it moving. Right? How many more minutes I got? Testing. Testing. Huh? Testing. All right. He keeps calling me and I keep calling him, and this is not okay. Okay.
So did the gentleman send us the videos? I haven't seen the videos from Miss Hill.
You haven't? Okay, I gotta pay them today. I gotta figure out how to pay them. That's my problem I'm having. I'm having a problem because I don't know how to pay them. Oh, she's worrying me to death. All these people are worrying me to death. I'm gonna pay her via PayPal. And I gotta do that. I'm gonna pay everybody via PayPal and then just pay me back. Oh, God. This is ridiculous. My life is ridiculous. Hey, how you doing? Oh, okay. Well, I'm in the studio. I go on in about 3 minutes, but I just wanted to tell you real quick. Okay, so I just need you to just hang in here with me for another 2 or 3 weeks, all right? Because there's some really good stuff coming down the pipe with this clinical trials, and that's going to be your bread and butter. I want you to start thinking about research like you did about 4 years ago. You thought that was going to be your new thing. And I think that that is absolutely what we should be doing, is that. Because there's good money in that. There's good money in that. Now, I have met a gentleman who is Nigerian, who is a clinical research guy. He has his own company. He's Nigerian, and he is out of Philly, and he has already set up 400 pharmacies, Nigerian independent pharmacies across the country. And they want to turn these pharmacies into either clinical trial sites and or recruitment sites. So they're trying to do what I want to do, except that they don't know how to do it. I know how to do it, and you know how to do it. Okay? All right. So all of these pharmacies have Nigerian physicians that they know. That their kids go to the same church and school, and so they already know that, right? Okay, so I just want you to kind of hang loose. But what I need from you today, if you can, is to give me the phone number and give the guy a call, give him a heads up for the guy you said would credential for $150 per insurance. All right, I need him ASAP because I've decided we're not doing Bennett because I really did not appreciate that crap yesterday. Okay, so well, yeah. Okay, all right, listen, are you going to be available this afternoon? Okay. Okay, please, I'm going to call you after 5. Please answer, okay? Okay, bye. All right. Okay. Dr. Lenore Coleman. I am president and founder of Healing Our Village and Total Lifestyle Change. And it is Saturday, and we do our Sugar Busters Diabetes Self-Management Training Program on Saturdays. And this is a 7-part series that we do every month for those patients that have diabetes and are struggling with getting their numbers under good control. So we are a certified program through the Association of Diabetes Education Specialists, and we have been doing this program for over 10 years, and we have a lot of success with the patients that actually go through the series and work with our wellness coaches. So in 2023, the way that you work with Healing Our Village is you purchase our Village Club 365. And that is $1 a day. It costs $365. It's $1 a day. And for $1 a day, we will get your diabetes under control. We will get your blood pressure under control. We will get your cholesterol under control. We will help you lose 5 to 10% of your body weight. Whatever it is that you're trying to do in 2023 in terms of your improving your health, you're going to have your own personalized medical team. That's your concierge medical team that you'll be able to talk to help you get to your target. And so if you go to villageclub-global.com, there's more information about the program. And so Sugar Busters is part of that. Sugar Busters is part of that because we have had great success in working with patients to get their diabetes under better control. We do it all over the country. We've been doing it for now 28 years, a long time, and we do very well. All you have to do is just let us help you. And so I really encourage you to start working with Healing Our Village. And thank you so much for tuning in today to our Sugar Busters medication segment. This is segment number 2. So we're going to talk about the diabetes medicines. A lot of the people are on the wrong combination of medicines to control their diabetes. They're on the wrong combination, and they don't know that they're on the wrong combination. And so that is why, especially in 2023, it is so important that you work with a diabetes educator or a clinical pharmacist to help you get on the right combination of medicines to get to your blood glucose target, which is in the morning fasting, 90 to 130, and your A1C needs to be as close to 7% or less as possible. Normal hemoglobin A1C shouldn't be higher than about 6. So we are really trying to get you to get down to the good numbers that we need you to have so that you're not damaging your eyes, damaging your kidneys, damaging your nerves, and damaging your heart, which is really important, so that you're not going to be having heart attacks and strokes. That's the leading cause of death for diabetes, especially for type 2 diabetes. So let's jump in and just start talking about the medications for the management of diabetes. So there are oral medications, there are injectable medications, and there is insulin. And so we're going to go through each class of medication, most of which need to be used together. So when I start talking about combinations of medication, most patients cannot be controlled only by taking oral medications. At some point, if you live long enough, and diabetes is a progressive disease, you may require the addition of an injectable medication. You may require the addition of insulin. And so it's important that we know that, and that it has nothing necessarily to do with you. Diabetes is a progressive disease. So it's not that you're necessarily doing anything wrong. It's just if you live long enough, you may require some extra help to get your blood sugar under better control. Now, when you talk about oral medications, a lot of people think is actually oral insulin, but they're not. It is not oral insulin. Oral medications either help your body make more insulin, or in most cases, what it does is help your body to use your own insulin more effectively. So most people who have type 2 diabetes have plenty of insulin floating around. In fact, that's the problem. They have something called hyperinsulinemia. They have high levels of insulin circulating in their body. And the reason why I say that's a problem is because it's also known as insulin resistance. So your body is actually resistant to the effects of your own body's insulin. And so what the oral medications do is help your body become more sensitive, helping the cells of the body become more sensitive to the effects of your own insulin. And so in part one, our overview of diabetes, and if you didn't get a chance to watch it, you need to go to our Healing Our Village official website. All the videos are there, and you need to watch that first episode. Okay, very important, because you need to understand what insulin is and how insulin works. So when you first get diagnosed with diabetes, what we usually do is start you off with a low-carb diet, right? So we're going to give you a nutrition plan that doesn't have a lot of sugars and starches in it. And then we're also going to try to increase your exercise, how much you're moving every day. And that's really hard. That is a really hard thing to do. I know, because I struggle with that myself. I need to get more exercise. I need to get to my 10,000 steps a day, but I've had 2 hip replacements. I got some knee issues going on. So it really is very difficult. I get it, but we got to figure it out. I'm trying to figure it out, and we're here to help you figure it out as well. Now, when you talk about how the oral medications work, how the diabetes medications work, how even the insulin and the injectables work, they either increase the production of insulin by your pancreas, or they slow down how fast the carbohydrates are broken down and absorbed into your system. People with diabetes, when you eat a carbohydrate, when you eat your potatoes, your rice, your tortillas, anything, your sugars, when it gets into your body breaks it down real fast and dumps it into your blood sugar, into your bloodstream. That causes your blood sugar to spike. It causes a spike in your blood sugar. We don't want spikes in your blood sugar, because when your blood sugar spikes, it damages your kidneys, it damages your eyes, it damages your heart, it damages your blood vessels. So we want to keep your blood sugars as even as we can throughout the day. So there are some medicines that slow down how fast the body breaks down the carbohydrates and how fast the body absorbs it into your bloodstream. There are some medications that increase the ability to move that blood sugar, that glucose molecule, out of the blood into the cells. So they actually increase the ability of that to happen. And then there are some medications that decrease the production of glucose from the liver. So at night, your liver actually produces glucose. It actually sends glucose out into your body, right? Because during the night, your body still is functioning. Your brain's still functioning, your heart's still functioning, your kidneys are still functioning. And so all throughout the 24 hours, your body has to have glucose floating around. So in people with diabetes, they have an increased production of glucose from the liver at night. So there are medications that decrease the production of glucose from the liver, especially at night. Okay, now, this is a very busy slide. And the only reason I put this slide up here is because when I first graduated from pharmacy school in 1979, so I've been at this a long, long time, there were only animal insulin, so we only had beef and pork insulin. There were no synthetic insulins. And we had what we called first generation sulfonylureas. So some of you, if you're old enough, remember back in the day, there was a drug called chlorpropamide, and most people that had type 2 diabetes was on that drug. And those drugs, those first and second degree sulfonylureas, what they did was help your pancreas put out more insulin. That's the way they worked. All right, so since 1979, and we're in 2023, look at all the different things that we've learned through research in diabetes of all the different pathways, where those pathways, once they get a defect, increase your blood sugar, cause hyperglycemia. So we knew about that core defect, the pancreas. We've known that at a long, long time. But then we found out about the liver. And then we found out about the fat tissue, the adipose tissue, that it actually is active. And then we learned about the colon and the stomach and the intestines. And so there are now drugs that work in those areas. We learned more about the kidney here recently. That's a recent development. And then the brain. So all of these different parts of the body have mechanisms that contribute to your blood sugar going up. And so now there are medications that work on these different parts of the body to decrease that defect so that your blood sugar doesn't go up. It keeps your blood sugar moving toward the normal range. So that's what we're trying to do. So here are three slides that actually show you all the medications that are out there available for the management of diabetes. So these are all these non-insulin oral agents that we're talking about. So we're talking about the alpha glucosidase inhibitors. They're the ones that work in the gut. We're talking about the biguanide, that's metformin. It works at the area of the liver. There's the bile acid sequestrants. Again, it's working in an area of the body that basically slows things down in terms of digestion. DPP-4 inhibitors, those are relatively new, as well as the dopamine 2 agonists. They now have a role. We don't use them very much. The DPP-4 inhibitors are used quite frequently, and they have again been found to do something in the gut. We have the glinides, that they actually increase insulin secretion. Very seldom used, that class of agents, but they're available. You got your GLP-1 receptor agonists. Now, these are injectable medications, but they have also been found to work in the gut. And most recently, there's a new one that just hit the market, tirzepatide and Mounjaro. You probably have already started to see the Mounjaro commercials on the television. This is a drug that also works in that area of the gut with GLP-1 and GIP. So it hits both of those gut hormones. And that's why this drug actually has been found to really be very good for weight loss. So they're also looking at that drug and using it for weight loss. You have the GLP-2 inhibitors, those are oral medications. They work at the area of the kidney. And then I mentioned the sulfonylureas. They were actually the first kid on the block. And what they basically did was increase insulin secretion from the pancreas. The problem with those agents is they will lower your blood sugar whether your blood sugar is high or not. So these agents, sulfonylureas, cause low blood sugar reactions. And low blood sugar reactions are bad. So some of the newer agents don't cause as much hypoglycemia, do not cause low blood sugar reactions. So that's why here at Healing Our Village, we really prefer using the newer agents versus the older agents. Here are your insulins. So you have your long-acting basal insulins. That's Detromir. We have Glargine, both from Sanofi and Lilly. And then we have MPH. MPH is an intermediate-acting insulin that's been around a long time. When you look at the insulin bottle, it has letters on them. R means regular, N means MPH. All right? So they have letters on there that designate sort of how fast those drugs work in your body. There are the prandial insulins. That's your Novolog, your Apidra, your Humalog. Those are the ones that need to be taken before the meal. And the really rapid-acting insulins need to be taken right before the meal, 5 minutes before the meal. Whereas your regular-acting insulins, they take 30 minutes to get started. So you got to take them 30 minutes before the meal. And then there are premixed insulins, where both a longer-acting insulin and a shorter-acting insulin are in an insulin pen. Those are called combo insulin products. And a lot of people are on those as well. Not as many as could be, because most insurance companies do not cover combination insulins. Okay, so let's go through each one of them. Let's talk about metformin. Metformin is that biguanide. Metformin is the one that keeps the liver from releasing too much glucose. This is a very good agent. Up until just recently, I'm talking about within a year, this was the first line drug. This was the drug that we prescribed after you're changing your diet and changing your exercise routine. If that didn't do it, then the first drug they put you on was metformin. Most recently, that's changed. So there are some newer agents that are SGLT2. We'll talk about those. They are now being used as first line as well, depending upon if you have kidney disease or heart disease. All right, so things have changed within the last 24 months. All right, the guidelines from the American Diabetes Association has changed. But many physicians haven't kept up with the changes. And so you might not be on the right combination based upon the new guidelines. That is why having Healing Our Village as your concierge medicine provider helps you, because we'll make sure that you're on the right combination based upon the latest guidelines from the American Diabetes Association. Now, the oral glucosidase, the alpha glucosidase inhibitors, very seldom used. Acrobose is probably the most common drug in that class, very commonly used in Europe. Basically, this is the drug that I said worked at the gut that slows down the digestion of the carbohydrates. So it keeps your blood sugar from rising too fast after a meal. Those are called postprandial, after eating, postprandial spikes. Postprandial spikes have been shown to cause damage to your eyes, damage to your kidney, damage to your blood vessels. So we don't want spikes. And so especially in patients that eat a lot of starches in their diet, these are good drugs for them. The problem is it causes a lot of gas. And so people don't like taking these medicines because of the nausea and because of the gas. So they're not very commonly used. Your DPP-4 inhibitors are relatively newer agents within the last 10 years or so. They work by decreasing glucose output from the liver, and they also increase insulin release from the pancreas. Have very few side effects, maybe a little bit of diarrhea, a little bit of stomach pain when you first start using them, but they are very effective, but they're also mild acting drugs. When I say that, what I'm saying is they only decrease your hemoglobin A1C number by about 0.6% in most patients. We like drugs that actually decrease your A1C by a full point. So these are drugs that are usually used early on in the diagnosis. So when you first get diagnosed and your blood sugar is just starting to get elevated, these are good drugs to use after you've been diagnosed with diabetes. Now, the SGLT2 inhibitors are new drugs as well. They came after the DPP-4s. They work with your kidneys and the process of urination, and they help remove excess sugar from your body so that you urinate that sugar out. So as the blood passes through the kidneys, they filter glucose, they filter water, and then they usually return those things back into the circulation. But these drugs prevent that so that the water returns back, but the glucose goes out. All right, so that's how these drugs work. And in people with type 2 diabetes, we know that for whatever reason, the kidneys retain more of that glucose and it reabsorbs more of that glucose back into the body. So these agents work pretty well. They work pretty well. Side effects are vaginal infections if you're a woman, so you can get a yeast infection, or you can get dehydrated. So it's important that you drink water if you're on those medications. Now, tips for remembering your medicine. Do you see that little medication box there in the picture? Everybody who's on multiple medication needs to have a medication box at home. So you can put your medicines in there for the week and you can remember to take them, all right? My brother had one for the month. So I used to fill up his med tray for the month, and that worked out very well. You need to take your medicines at the same time every day. And in order to do that, I usually tell patients to associate their medicines with something that they do. So I eat my breakfast or I make my smoothie. So that's why the pills are right there by the blender. So when I drink my smoothie, I take my medicine. All right, so you need to figure out ways to give yourself clues to take your medicine. Most of us have cell phones. Set an alarm. If you're supposed to take something at 9 a.m., set your alarm for 9 a.m. If you're supposed to take something at bedtime, set your alarm for 8 p.m. or 9 p.m. So when that buzzer goes off or the music goes off or the jingle goes off, whatever you got, right? You'll know, oh, I got to take my medicines. All right. Having the pill tray helps because you'll see that you forgot by just looking in the pill tray. Makes it real simple. Some medicines need to be taken with food, so you need to ask your pharmacist about that because we do not want you to have an upset stomach. Some medicines work better if taken on an empty stomach. So the only way you know that is asking your pharmacist. In terms of other tips, storing them at room temperature. Do not take medicines that are discolored or expired, so you need to look at the prescription label to make sure that they're in date. And remember to take your medicines when you're traveling. Do not leave town without taking your medicines. Put that in your suitcase. It's the first thing you do when you pack for a trip. Because you go out of town and you don't have your medicines, you're going to have to go see a doctor wherever you are to get prescriptions for that pharmacist to fill it. Even if it's a CVS, it doesn't matter because their computer systems are not correlated to each other, especially out of state. And even the ones that are in state, it's hard for you to be able to transfer stuff from pharmacy to pharmacy. It seems simple, but it's not. Trust me. So you need to just take your medicines with you. That's the best way to do it. Now, let's talk about the class of medications that I like the best. I like GLP-1s. And the reason I like them the best is because they increase the cell's ability to use the insulin. And they increase your feeling of fullness. They actually have an effect on the brain so that in your satiety center, you think you're not hungry. And that's really important because most people that have diabetes are overweight. And so if we can control your hunger, you'll eat less. And if you eat less, you'll lose weight. And if you lose weight, then your body is more efficiently able to handle your blood sugar. So that's why I like these agents, because they actually do help you lose weight. They come as a pre-filled pen. I like that too. So you're not trying to figure out how to pull this medicine through into a syringe from a bottle, right? You just dial in the number that you're supposed to take and just inject the insulin. There are needles that go on top of these pens, insulin pens. These needles are microfine. You won't even feel them going penetrating your skin. They are so thin. So that's why I like these agents. All right? Now, if you have extra ones, they can be stored in the refrigerator, but the one that you're using should be kept at room temperature. The newest addition to this class of medication is Mounjaro. You probably started to see the commercials. These agents work in the gut. They affect the GLP-1 and the GIP. So those are actually hormones in the gut that have to do with how your gut processes your sugars that you eat. And so these agents work very, very effectively in people who have type 2 diabetes. So I like these agents mainly because they have very few side effects. They only work when your blood sugar is high, so they have very little low blood sugar reactions. Very little low blood sugar reactions, that's very important. And I like them because they help you to lose weight, because they decrease your hunger, and that's also important. Now, let's talk about insulin. Who are candidates for taking insulin? If you live long enough and you've had diabetes for 20, 30, 40 years, you may end up having to require insulin injections. It's just a fact. Now, some people never have to take insulin, but there's about, I'd say 40% of the population right now that need to be on insulin and are not. Okay, so that's a problem. Now, insulin's also used for temporary conditions, like for pregnancy or for surgery, or if you have a severe illness. You may require taking insulin just for short periods of time, and then you can go back, once you get better, to your oral medications for diabetes. When should insulin be used? In someone without diabetes, the way it works is that the pancreas does a steady amount of insulin over that 24-hour period. And then when you eat, there's a spike in insulin from your pancreas to cover the meal. That's the way it works if you do not have diabetes. If you have diabetes, We're trying to mimic the same thing. So most of you will need to be on basal insulin, which is the long-acting insulin that makes sure that everything is, the fat cells in your body don't break down, and that it keeps you in a steady state in terms of your blood sugar control. And then there's bolus insulin that you'll use before a meal. So most people who have diabetes that require insulin are taking 2 shots a day. Or they're taking 1 shot of the basal insulin in the evening and covering their meals with the oral medications. So those are probably the 2 classes of people that we see most commonly. Now, the bolus insulin is the rapid acting, that one I told you needed to be taking, could be taken right before the meal, is the Novolog and Humalog and Apidra. So you can take those about 5 minutes before you're going to eat your meal. Short-acting insulins are your regular and your Velocilin, and it needs to be taken 30 minutes before your meal. Basal insulins can usually be taken in the morning, or they can be taken in the evening, okay? And they are long-acting. That's your Lantus, your Levemir, your Basaglar. But your MPH, or your Lente, are your intermediate-acting insulins. They are also usually taken once a day, but they don't last as long as your long-acting insulin. So at this stage of the game, I think that most people with diabetes who are on insulin should be on the long-acting insulins, and the one that has data that shows that it lasts for a 24-hour period of time. Now, remember I said they're combinations. These combinations are usually not covered by insurances, but there is Humulin 70-30, Novolin 70-30, and even the Humalog have 75-25. The numbers mean that 75% of the insulin is the longer acting or intermediate acting insulin. And then 25% of that injection, of that tube, has the 25% of that insulin. So it's 75-25. 75 units, 25 units, that's what we're looking at. And I actually like the combination insulins once you get stabilized, because they make it easy, especially if you don't want to take 2 shots a day. So you can just take the 1 shot, and the 1 shot basically, or 1 shot, sometimes you take 2, but a lot of folks can get away with just 1 shot of the mixture, and it'll cover them for the day. Now, we talked about timing. I'm going to cover it one more time. So your rapid acting insulins need to be taken within 15 to 30 minutes of the meal. They start working in 5 minutes. They peak around 2 hours. And you do not take that insulin if you're not going to eat, because that's how you get into low blood sugar reactions, okay? Your short-acting insulins regular, take again 30 minutes before the meal. Long-acting, Lantus, Levemir, Basaglar, they should be taken once a day usually, sometimes twice a day. And if used alone, they usually can cause a little bit less hypoglycemia. It's the shorter-acting insulins that cause more of the low blood sugar reactions. And with most of your long-acting insulins, your Lantus, your Levemir, your Basaglar, you're not going to mix those in the same syringe necessarily as your short-acting insulins. So that's why you have to take them separately, right? Okay. So we're going to take a short break right here. We're going to let you go get yourself a glass of water, stand up, walk some steps for about 2 or 3 minutes, and we're going to be right back.
Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village.
Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program, all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family?
Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up. About Sugar Busters. We do this every week. I'm very interested in trying to get this information out to the masses of people. So again, please, we do this every Saturday. We stream from 12 to 1, sometimes live, sometimes pre-recorded. So please, there are 7 sessions that you need to go through. And if you go through all 7, I guarantee you the management of your diabetes is going to improve. So we were talking about insulin. We already covered when insulin should be injected. So now we're going to talk about insulin pens. I love insulin pens. Nobody in 2023 should be drawing up insulin from a bottle into a syringe. Those days are over. Days are over. So we need to be using insulin pens for the injection of insulin in the United States of America. And if your insurance company doesn't cover it, then you need to have your doctor call in a prior authorization and tell them that you have to have the pen. Very simple. Because they're easy to use, they're faster to use, they improve your attitude toward injecting the insulin. The needles are microfine, you can't even feel it. And we know that the accuracy is there because we know that people with diabetes have problem with their eyes. And so if you're trying to draw up to a certain line on a syringe, it's just a mess. So we don't want you to have to do that. So remember, anybody out there on insulin, if you're not using an insulin pen, the next time you see your doctor, let's try to get that together. Or I'm hoping that all of you are going to join Village Club 365. And then we can make the phone call to your doctor and help them get your diabetes under better control. Where do you store insulin? You store it in a refrigerator if you're not using it. The one that you are using, you keep it room temperature. You never put insulin in the freezer because you do not want to use frozen insulin. If for some reason that happens by mistake, you throw it away and get you another bottle. All right, you should always have an extra vial available to you. You should never be in a position where you have run out of insulin. Or syringes. You need to always have a extra box of those floating around as well. Look at the insulin bottle before you pull it up. It shouldn't be discolored. Make sure that you check the expiration date. It needs to be in date. All right, it shouldn't contain a bunch of particles or little globs inside the bottle. That's not good. So if you are on a longer acting insulin, you should shake it, and then that thing should immediately go into solution. Immediately. If it doesn't, you need to throw it away and get you another bottle. All right? And you should store, again, the unopened vials that you haven't used at all. They can be stored in the refrigerator. Where do you inject insulin? You can see from the picture she's injecting in her abdomen. That's the best place to inject. You can do your upper or outer arm. You can use the top of your or outer thigh. You can use your buttocks, but most people are injecting in their abdomen, and they're rotating around the abdomen so that you're about inch away from each injection site. So you need to rotate your sites. You should never inject insulin in the same place all the time, because what it does is it causes little fat pads to grow underneath the skin. So you don't want to do that. Okay, so you need to rotate your sites. And you, of course, never inject into your belly button. This is a picture of a Sharps container. Those can be purchased at the pharmacy. If you don't want to buy one of those, you can just use a milk carton and put the used needles and lancets and strips into that container or the carton, and then seal up those containers before you throw them into the garbage so that the top doesn't fall off. So you should dispose of the container in the garbage and as directed by whatever your local waste management authority says for you to do, okay? Now, why, I just told you that 40% of people in this country should be on insulin and aren't. Why is that? Okay, there's a lot of obstacles to insulin therapy, a lot of physical barriers. Some people have shaky hands, and so they can't hold a bottle and pull the syringe. That's why everybody should be on an insulin pen, because all you have to do is just dial it in. It's real simple. All right, maybe you can't see to draw up the insulin. That's another physical barrier. There's a misconception that, oh, my diabetes must be getting really, really, really bad because now I have to take insulin. That's not true. Doesn't mean your diabetes is getting really bad. It just means that the oral medications can't hold you anymore. Diabetes is a progressive disease, and so therefore, you need to go on insulin. All right? All right. And it's actually, if you think about it, that means you're living and you haven't died from diabetes. That's actually a good thing, right? We want everybody to live a long life. So there's a chance that if you live long enough, you'll need insulin therapy. A lot of people have an anxiety or fear against injections. They don't want to inject, all right? But you got to get over that. You got to get over that. Or they don't want to have to think about doing something life-saving twice a day. I get that, okay? So a lot of people forget doses, don't remember to take it. All of these are the obstacles that we see with insulin therapy. But now with the pens, we can get over that whole physical barrier thing. And now, in terms of you don't want to inject it because you think it's going to hurt, you can't even feel the needle going in. Trust me, okay? Now, a lot of people with diabetes are on other medications, other life-saving medications that we need you to know about, all right? There's a good chance that you're on aspirin. You should be taking a baby aspirin, or you can take 325 a day, but most people are taking baby aspirin, all right? Especially if you have high cholesterol, especially if you've had a heart attack. It's very important that we keep your blood thin so that you don't have increased risk of stroke and heart attack, all right? So this is a discussion that you need to have with your doctor. Statin drugs. These are drugs that are used for cholesterol lowering. People with diabetes, a lot of them have high cholesterol in addition to their diabetes. So if you have them both, that increases your risk of heart attacks and stroke. So you need to be on a statin. You need to be on a statin that lowers your cholesterol at least 30%. All of the statins don't necessarily give you that amount of lowering. So that's another discussion with your doctor. You need to find out what your cholesterol level is when you go to see them. You need to mostly be concerned about your low density lipoprotein cholesterol, LDL. So that's the question. How's my LDL cholesterol, doctor? And he needs to say it's less than 100, preferably 70. And so they'll make the decision if they're going to put you on a statin, all right? How's my triglycerides, doctor? That's another form of cholesterol. People with diabetes have high triglycerides. So your LDL might be okay, but your triglycerides are high. And that's not good, all right? Because when your triglycerides are high, the good cholesterol, HDL, high density lipoprotein, HDL, is low. So triglycerides high, HDL low. HDL is the good cholesterol that takes the bad cholesterol, LDL, out of your body. So this is important that you have good HDL levels, okay? So we got to control your triglycerides in order to make that happen. Those of you who have high blood pressure, and diabetes, you need to be on an ACE, angiotensin inhibitor, or an ARB, an angiotensin receptor blocker, ACE or ARBs. And they're usually given for high blood pressure because they can protect the kidneys. One of the main issues for people with type 2 diabetes is chronic kidney disease. That's why this year, Healing Our Village is focused on chronic kidney disease. I want to make sure that you're not spilling protein into your urine. How do I know if you're spilling protein into your urine? You're going to, when you see your doctor for your yearly physical, you're going to ask them to run the urine tests and see how well your kidneys are functioning. And there's something called eGFR. So that's glomerular filtration rate, GFR. You need to know how well your kidneys are functioning, right? You need to be up in the 80s and the 90s in milliliter per minute in terms of how well that kidney does what it's supposed to do. If your kidneys are starting to fail, then you're going to start to spill protein in your urine. So we need to have you see what your UACR is. That basically tells you how much urine protein is in the urine. If there's protein in your urine, that's bad. That means your kidneys are leaky and they got holes in them, and that protein is able to pass into the urine. That's not good. So this year we're focused on educating people about chronic kidney disease. It's very important, okay? So again, aspirin is a possibility. Statins you may be on, and if you have high blood pressure, you need to be on an ACE or an ARB. All right, so that is our segment on medications for diabetes. If you didn't understand something that we said today, you need to call our 800 number and get on board with Healing Our Village. We do this, Sugar Busters, it's on demand on our YouTube channel, which is called Healing Our Village Official. We want you to share our YouTube video link. We want you to get on our website, hovhealth.com, and like and subscribe for Facebook and for our Instagram, because every week we're sending out newsletters, we're sending out recipes, we're sending out information that you need to know for the management of your diabetes, and all of that is coming to you as part of Village Club and as part of my commitment to improving diabetes management in the diaspora. So we're doing work in Nigeria and Ghana, we're doing work in the Caribbean. So this is just not a US thing for Healing Our Village. I need to heal the whole village. Everywhere the boat left and landed is what I'm trying to do. So we're really focused on that this year. Step Up 90, this is an app. This is the coolest app ever. This is a weight loss app, but it also does diabetes prevention. We're starting a new cohort of patients next Tuesday at 6:30. We're going to be doing weekly Zoom classes on diabetes prevention and weight loss. And we want you to be part of the class. If you come on and be part of the class, you'll be assigned your own personal coach who's going to call you and talk to you and encourage you. And if you miss a class, we're going to review that class with you. All of that is what's going to happen. So I need you all to come and work with us at Healing Our Village. We're here trying to help you get to your goal in 2023. This is just a picture of my website, hovhealth.com. We have blood pressure cuffs up there. We have blood glucose meters. These are special blood glucose meters that talk to the cloud. They're Bluetooth, so we can actually see your numbers. Here at Healing Our Village, we're doing something called remote patient monitoring, where we work with your doctor so that you get special devices that you're using so that your doctor can see your numbers, we can see your numbers, and we can get your numbers under better control. Every Wednesday here at my building in Jonesboro, we do Wellness Wednesday, where there's someone here to take your blood pressure, there's someone here to give out a COVID test for you, So we encourage you to come and sign up for all of our programs that we're doing here on Wellness Wednesdays at 177 North Main Street in Jonesboro, Georgia. And again, I'm Dr. Lenore Coleman. The name of the company is Healing Our Village. That is our 800 number, 788-0941. We also have a nonprofit where we're doing a lot of really good work out in the community, and we need you to support us. We need your donations. So go to tlc-global.org in order to be able to sign up and be part of that outreach that we're doing with our nonprofit. And that's Sugar Busters for this Saturday. Thanks again for tuning in. And again, there's the website, hovhealth.com.
Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up.